Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. With me today is NFID Medical Director, Dr. William Schaffner, to answer some frequently asked questions and help put the risk of monkeypox into context. So, Bill, is monkeypox a new disease, and what is its relation to smallpox?
Well, Marla, monkeypox is related to smallpox in that the two viruses are in the same virus family. And they're also similar in that they both produce very dramatic rashes. But monkeypox is much milder. It's not a new disease. Once we eliminated smallpox, monkeypox became more evident in West Africa. And so people could diagnose it because before then it resembled smallpox. But it's not a new virus, but it's certainly become newly prominent.
Absolutely. Bill, is there any relation between monkeypox and COVID?
We shouldn't think of them at all in the same way. They are transmitted in very different ways. They have different manifestations. And COVID has the capacity to be widespread very readily. It's very easily communicable, whereas monkeypox, monkeypox is much more slowly spread most of the time.
So we'll dig into monkeypox now. What are the symptoms of monkeypox traditionally?
Yeah, so let's think about that a little bit. Once exposed to monkeypox, the virus gets into the body and then must remain in the body for a period of time, up to 2 weeks, if you can imagine, before it actually starts to make you sick. So it has what we call a very long incubation period. So after that 1 to 2 week interval, people start to develop the symptoms of any viral infection. They may get some fever, some aches and pains, feel kind of poorly, and get a headache, or perhaps have their appetite not be as normal as usual. And they can also, it's not necessarily, but they can also have some swollen lymph glands. Then after a couple of days, the rash begins to appear. Now, excuse me. Excuse me. Now, traditionally, as we all looked into our textbook, the rash had two striking characteristics. It was very numerous, and it first came out dominantly in the periphery of the body, that is, the head and face, the arms and hands, including the palms, as well as the legs and down into the feet. However, as this virus is spreading in the Western world, it's doing something different. There can be very few lesions, and they can be located on the trunk, in particular around the genitalia and around one's backside. So it's a much more subtle disease in the United States, Canada, and those European countries where it's now spreading. Now, the rash begins as just a blush on the skin, then becomes kind of bumpy and creates a blister. The blister is not as thin and fragile as the blister of, for example, chickenpox. It's what we call deep-seated and firm. Also, the description rubbery has been made so that when you press down on it, it's not easy to break at all. Now, this blister, this firm blister, will remain for a period of time and slowly begin then to recede and disappear. But this is a process that could actually take 2 to 3 weeks. And so you can see that people can be discomforted by having these blister lesions for some period of time. The contents of the blister are full of virus. And so that's why close contact, skin to skin, is how this virus is most frequently transmitted.
So, Bill, can the virus be spread asymptomatically if somebody doesn't yet have a rash?
Let's hold that thought for just a moment, because I'd like to talk a little bit more about the clinical manifestations. So I said there could be very few lesions, and particularly those around the genitalia. If they involve, for example, the penis, they can be not only disfiguring, but very uncomfortable and indeed painful. They can also occur not only on the backside, but within the rectum, causing an inflammation we call proctitis. That can also be very, very painful. And those are the dominant forms of the illness. We're also concerned on occasion if the lesions might threaten the eye, where it could threaten vision, or could occur in people who are immune compromised. There, of course, we would expect those persons' immune systems, since they are compromised, not to as readily control the virus, and they may be subject to more severe disease. Now, we've talked about the spread. Close, personal, physical contact, skin to skin, is the main highway, as I like to say, of transmission. That's the dominant way. There are a couple of other ways. One is if you get very close to someone within a couple of feet for a prolonged period of time, there could be some close-in respiratory transmission. And of course, the other way it could be transmitted is if you have lesions and are in a bed, you can transmit some of that virus to the sheets and to the blankets. And if somebody else then gets into that bed for a prolonged period of time, the virus could be transmitted to them and they could consequently become sick. How important these other two modes of transmission, through bedding and the inanimate environment and via the respiratory route, are, how important they are in comparison to close skin-to-skin transmission, is really not known. We think they are side streets of transmission, but this really does need more study, as does the question you have asked, which is still a very important and not entirely decided question scientifically. Could this virus be transmitted if you are without symptoms, either via the respiratory route or through saliva, or perhaps skin to skin, if, for example, the lesion were to become evident tomorrow? Could I transmit it to someone else today, even though the rash was not evident yet? Those are questions we don't know, but if true, they would actually contribute to the contagiousness of this virus.
So, Bill, who is at risk?
Well, the virus just likes to spread from person to person, but the truth is the current outbreak is occurring among men who have sex with men. And why is that? Well, there were a couple of gay pride / rave events where lots of people got together enthusiastically, and there was lots of cuddling and sexual intimacies that went on in Europe. They've been described in Spain, in Belgium, in Berlin, and there must have been some people either from West Africa or people who had just gone to West Africa who attended those rave events and brought monkeypox with them. It spread among those groups. Then everyone went home, back to their European homelands, to Canada, to the United States. They brought monkeypox with them, and then they began to spread it amongst their sexual intimates. So at the moment, the virus is dominantly being transmitted among groups of men who have sex with men, although it has started already to leak out into the general heterosexual population in small amounts.
So how can monkeypox be prevented? What's your best advice among both men who have sex with men as well as the general public?
Well, we'll talk about vaccines in just a moment, but we go back then to the kinds of advice that have been given for years to prevent the transmission of other illnesses that are transmitted through sexual intimacies. Number one, limit the number of sexual partners you have. Number two, don't do anonymous sex. Be very careful about that. Number three, since this is a rash transmitted disease, as I like to say, keep the light on, and before you're intimate with your partner, each of you inspect the other to make sure you don't have a rash. And if everybody's in the all clear in that regard, you can then turn off the light and have fun. The last thing I would say is, I've just talked about these large gay pride events. They have been accelerators. There are more of them scheduled. They're called gay pride for a good reason. People like to go there, they're relaxed, they see their friends, they have fun, and there's a lot of cuddling that goes on during those events. And I can just tell you statistically, in any event that occurs in the United States this summer, the monkeypox is likely to be there also and be transmitted. So think very carefully before you go to those events. Lastly, to put it very colloquially, grumpy Dr. Bill would say, keep your pants on and your zipper zipped up.
So I guess the question I would ask next then is, so who is actually eligible for either vaccination or treatment?
So let's deal with vaccination first. There is a vaccine that's licensed that will protect about 85% against smallpox. It's called the Jynneos vaccine. It's inoculated through a needle and syringe, takes 2 doses for a full course, separated by at least 3 weeks. It's in very limited supply. There's one manufacturer in Denmark who needed a monkeypox vaccine, right? But now countries all over the world are clamoring for the vaccine. So we have some, it's in limited supply. It's being sent out to state and local health departments. It's being targeted to individuals who have been exposed or who are likely to have been exposed. They're at the top of the list. Some health jurisdictions have enough vaccines so that they can open this up to anyone who might like to be vaccinated. So even if you don't think you've been exposed recently, but maybe in the future, in those health jurisdictions, you may be eligible. This is a changing phenomenon because more vaccine is coming into the country all the time. So please check with your local health department. Now, another thing about that, in order to get the vaccine to as many people as possible, many health jurisdictions are giving out now only the first dose, because we want to protect as many people in the short term as possible. And as more vaccine becomes available, then you can come in later, perhaps several months from now, and get the second dose. That second dose gives you the guarantee of protection for a longer period of time. And you don't have to worry. Even if several months go by and then you get your second dose, it still works perfectly fine. So that's a strategy that's being used by many local health departments. Again, make yourself aware of what's happening. And then I will mention only briefly, but because it's been in the news, I know the Food and Drug Administration is considering, hasn't decided yet, but is considering giving very small amounts of vaccine, not through the skin, but into the skin. We call that via intradermal inoculation. It's a bit controversial, but it's another means of giving more people some protection, because that inoculation takes only 1/10 of the usual dose. So that means more people could get potentially some short-term protection. We'll see whether that goes through, and we'll just see how well that works.
So more to come. I guess, Bill, can you share from your perspective what the significance of this recent public health emergency declaration is then?
Well, by declaring it formally a public health emergency that focuses attention and resources at the federal and local level. We need those resources because we're still trying to get diagnostic services out to people, find as many cases as we can, provide them treatment if they need it, and then also to find the contacts, inform them, and get them to, quote, from the point of view of sexual intimacies, isolate themselves for a period of time.
So wrapping up, Bill, I guess, there's been a lot of discussion and certainly a lot of news coverage. How worried should we really be as members of the general public?
I don't think we should be worried, but interested, of course. All of us are, particularly those of us in public health and infectious diseases. There is the question, could this monkeypox virus not be completely contained at the present time? Could it begin to integrate itself into our lives? Could it, in other words, become like an array of other illnesses that are in our society that are transmitted through sexual intimacies, syphilis, gonorrhea, herpes, and the like? And the answer is that could happen. I don't think we're quite at that tipping point yet, but that's a matter of concern. And then, of course, it would become of somewhat greater concern to the heterosexual population also. This virus doesn't care whether you're tall, short, fat, or skinny, or what your sexual predilection is. It just likes to be transmitted skin to skin. So we're not there yet, but that is a matter of concern that needs attention.